We've helped many cancer patients go from no options, get your affairs in order, to complete remission through the 14 years that we've been doing this work. There's numerous stories actually stand out to me, but one example, and this is a fairly common example, is that this particular patient, their doctor was trying to do a really good job for them. They had done a small panel of genetic testing for them of their tumor, and they had identified a mutation, and they were trying a targeted therapy for that mutation. Unfortunately, it wasn't having any effect, and the cancer was progressing, and the doctor told this patient to get their affairs in order. When they called us and we did a more thorough assessment of their tumor with a 550 gene tumor DNA panel, 20,813 gene RNA expression tests, what we identified was, yes, that gene that this doctor had been treating was involved in the cancer, but there were a couple of other genes that were quite prevalent, and these were what we call desensitizing mutations. These are mutations that get in the way of the treatment working. So what we actually negotiated, we did a little arm twisting and a little pushing, but we got the doctor on board to prescribe a drug that would help kind of tie the hands of these desensitizing mutations so the targeted therapy could actually work. The doctor was very reluctant, really tried to talk the patient out of it, but we were able, and the patient was a very good advocate, we were able to get the prescription, we were able to get the patient on the drug, and within 3 months, all of their tumors had responded. They had a complete response. This patient is now, a year later, cancer-free. I think that's the story. This is not a unique scenario, by the way. This is not an exception to the rule when all of the most thorough diagnostics, research, and advocacy support are applied, really, with precision cancer medicine.